Welcome. My name is Dr. Kiiru J.M., an obstetrician and gynecologist, a fistula surgeon working in Westlands Medical Center. Today, we will discuss high blood pressure during pregnancy. This is also called PET, and in its worst condition, it can be called preeclampsia. Your blood pressure, which is measured in millimeters of mercury, is recorded regularly during your pregnancy. It is recorded as systolic pressure and diastolic pressure. For example, 100/20/70 millimeters of mercury. If you have high blood pressure or hypertension, your heart has to work harder to pump the blood around your body. This can affect the heart muscle. Hypertension affects around 10 to 15% of pregnancies. Different types of hypertension in pregnancy, like I had said earlier. We have chronic hypertension, where the high blood pressure was present before pregnancy. We also have pregnancy-related high blood pressure or gestational hypertension. That's preeclampsia. For each of these different types of hypertension, there are 3 levels. Mild hypertension, which refers to a blood pressure between 140/90 and 149/99. It may be checked regularly, but does not usually need treatment. Moderate hypertension refers to a blood pressure between 150/100 and 159/109 millimeters of mercury. Severe hypertension refers to a high blood pressure of 60/110 or higher if you already have high blood pressure, which is called chronic hypertension. Many women with chronic hypertension will be taking drugs to keep their blood pressure within range. Some drug treatments for high blood pressure are not recommended in pregnancy. If you are taking tablets, it is important to see us to find out whether you need change to other drugs before you become pregnant. If you are taking medication to control your blood pressure and you become pregnant, talk to us immediately. You may need to change to a different medication. We will talk to you about this. If you take drugs to lower your blood pressure, this can reduce the blood flow to the placenta and to your baby. It is important that your antenatal team monitors you closely to ensure that growth of your baby remains normal. Make sure you attend all your antenatal appointments. While the type of treatment you are given will depend on the cause of your blood pressure, the key to a healthy pregnancy is to make sure that your blood pressure remains under control. Having checkups with your antenatal team is the best way of monitoring your condition. You should be offered additional antenatal appointments based on your needs and the needs of your baby. You should keep active and get some physical activity each day, such as walking or swimming. Eat a healthy, balanced diet and keep your salt intake low, as this can reduce blood pressure. You may have heard that some supplements such as garlic might prevent high blood pressure. The truth is that there isn't enough evidence to show that the following supplements are effective, and they are not recommended as a means of preventing high blood pressure in pregnancy. Magnesium, folic acid, antioxidants like vitamin C and E, fish or algal oils, and garlic. Pregnancy-induced hypertension or gestational hypertension affects around 16% of pregnancies. This means that out of 100 pregnant women, 16 will develop high blood pressure in pregnancy. This usually occurs late in pregnancy, that is after 32 weeks. The next type of hypertension in pregnancy is preeclampsia. Preeclampsia is a pregnancy-related condition that usually causes high blood pressure and protein in the urine. That is called proteinuria. It is more common if you have high blood pressure before becoming pregnant, or if you have had preeclampsia in a previous pregnancy. If this applies to you, attending regular checkups to have your blood pressure and urine tested is even more important. Preeclampsia also affects the placenta, so regular scans are needed to check that your baby grows normally and remains healthy. Preeclampsia affects 2 to 5% of pregnancies. If untreated, it can lead to seizures or fits, and on rare occasions, the mother's death. Let us now talk about labor and birth. If you are taking medication to control your blood pressure, keep taking this during labor. If you have mild or moderate hypertension, your blood pressure should be monitored hourly during labor. As long as your blood pressure remains within target levels, you can hope for a natural vaginal birth. If you have severe hypertension, your blood pressure will be monitored continually in labor. If your high blood pressure is severe, you may be recommended an operative delivery, either forceps or ventrals or cesarean section. Thank you. Kindly do not forget to subscribe to our YouTube channel. You can also follow us on Facebook and Twitter, or visit our website and our blog to book appointments. Thank you.